lock for safety's sake. Respecting the patient's privacy is one of the principles of good nursing care, but it's also mandated by the Patient Bill of Rights. That means that window blinds and drapes need to be closed in an effort to provide privacy while care is being given. Privacy screens or privacy curtains are always pulled around an individual that might be sharing a room with someone else. Curtains protect a person from being seen by others. However, as you would know, it doesn't block out any sound or prevent conversations behind the curtain from being overheard. So be mindful of that when you're giving care, and keep your voice level a little bit lower so that that conversation can remain private. Each unit provides a private closet and furniture items for the patient's clothing and their personal belongings. Staff are also instructed to always knock and wait for a response before entering a resident's room in order to help maintain their privacy. A restorative environment promotes independence and self-care. It increases the person's self-esteem and motivation. In a long-term care facility where residents may be staying for long periods of time, efforts are made to create a home-like environment. It's done by the use of wall treatments and furniture that's designed to look less institutional as it might be in a hospital setting. Residents are encouraged to bring in their own clothing, some of their own furniture, and sometimes they will bring in photographs to hang on the wall, all in an effort to make it seem more like home, of course, as space can permit. It's more difficult to maintain a restorative environment in a hospital type of a setting. While the units are neat and clean, you can hardly say that they really look home-like or comfortable. These patients, though, also need a restorative environment, as those do in other long-term care settings. You're going to have to be a little bit more creative in order to get that kind of a restorative environment in a hospital. Some of the ways that I've seen it work is allow the patient to display some of their greeting cards, get well cards that they might have, being able to display them attractively, maybe on a wall board or at their bedside stand, allowing them to bring in a special pillow of their own, maybe a teddy bear. If you have any questions, check with the nurse, but frequently those items are allowed to help things feel a little bit more like home. Each unit contains furniture and equipment to meet the individual needs. This equipment would either be located in a single or a double room. A private room is a single room and it only contains one bed. A semi-private room, sometimes called a double room, contains two beds. Years ago, we also had frequently what would be a ward. A ward could be 4 beds, could be 8. Maybe you've seen old movies where there are even more numbers of people than that in a given room. Those are not nearly as popular as they had been in years gone by, and you will see very few of them, although there are a few places left that may have 3 residents in a room, but it's becoming more and more uncommon. Each room is numbered, and in addition, if the person is in a semi-private room where there are 2 beds, the bed is also numbered with either an A or a B, or 1 or 2. So it could be room 841A or 841B. Generally speaking, the A bed would be on the left. They go in a clockwise fashion, so A would be on the left, B would be on the right. Or if the beds are a nearer one or farther, generally the one that is closest to the entrance to the room would be bed A, and the further one is bed B. Beds have electrical or manual controls. They always used to have manual controls, but you will see that most of those beds are now being replaced with electrical controls. They are raised horizontally to give care, as was mentioned before, so that you can prevent bending and reaching and help maintain better body mechanics. Beds must be returned to their lowest position, however, when care has been completed. There are 5 basic positions that a bed can assume. The first is called a high Fowler's bed. High Fowler's position is where the head of the bed is elevated 90 degrees, or it's at a right angle. The primary time that you would have the bed in that high position would be when the patient is eating to help prevent choking. They would be in a high Fowler's position. The next position is called a Fowler's position. That's where the head of the bed is about 45 to 60 degrees. The individual is in a semi-sitting position. And the next one is a semi-Fowler's position. Semi-Fowler's means that the head of the bed is elevated about 45 degrees and the knee position is elevated about 15 degrees. This is a comfortable position for an individual, and it helps to prevent them from sliding down in the bed by having the knee gatched, is what we call that when the bed is elevated, or the foot of the bed is elevated a little bit. Raising the knee position, however, can cause some problems with circulation. And that means that you will need to check with the nurse before assuming that that semi-seated position, that semi-Fowler's position is what is used in your facility. Sometimes a semi-Fowler's position might mean that only the head of the bed is elevated about 30 degrees and the knee gatch is not elevated at all. So be sure that you check in your facility of which definition of semi-Fowler's they're going by. Trendelenburg is another position, long word for a position that means that the head of the bed is lowered and the feet or the foot of the bed is raised. A time that might be used would be if the person has going into shock and they want to immediately get blood supply to the heart and brain. Trendelenburg can help that individual. You need to get permission, and there is a written physician order before you would place an individual in Trendelenburg position. The last bed position is called reverse Trendelenburg. As the name suggests, it's just the opposite of Trendelenburg, in that the head of the bed is up, but the feet are down. Again, with that position, you would need to get a physician order. Side rails are attached to all of the beds in hospitals, but rarely will you see them used nowadays in long-term care settings. Side rails in the past were thought to help prevent falls. Research, however, has suggested that side rails don't necessarily accomplish this goal. In fact, many falls occur when the patient has their side rails elevated. This can result in serious injury and even death. Before you use side rails in your facility, know the policy in your setting whether or not side rails are permitted or not. If they are used, be sure that you check them, that they are attached securely so that they may not come down inadvertently when the patient puts their arm on it. Side rails should never be used to attach things such as catheter bags, IVs that have tubings. Those kinds of things can cause problems if you raise and lower the side rail. You can actually pull out a catheter if it might be, pull it out from the patient and cause harm to them. So never place any attachments on the side rails. The next item is an overbed table.